Hello, everyone. I hope you're all doing well, and I hope that you find my presentation to be informative. So, I'm just going to jump right into it. I'm just going to go ahead and click on my profile. Now, this new documentary is on an infection called gangrene caused by a bacteria known as C. perfringens, I think it's pronounced. It's labeled as horror, and there is one picture that might gross some people out, so just a fair warning. The synopsis of this is a look at the bacteria and its ability to develop into a necrotizing infection that can lead to amputation and death. It touches on the transmission, pathogenesis, and some diagnostic studies as well as treatment. So let's go ahead. So the bacteria is gram-positive and it's anaerobic, meaning that it needs no oxygen to survive for growth. The bacteria is also rod-shaped from the Clostridium genus. Now, one of its interesting abilities is the fact that the bacteria is endospore forming. So this spore is built around a protective coat, and some evidence suggests that the coat is built of specific proteins that provide protection from the human chemicals and lytic enzymes. Because of this, the bacteria is capable of surviving under extreme conditions for a very extensive amount of time. Also, the spores facilitate the transmission of the bacteria into the host that later releases its toxins, which is discussed a bit later. So if you were to look under a microscope, this is what you would see, gram-positive rod-shaped here on the right, top and bottom. The CDC reports about 1,000 necrotizing infections a year in the United States. This number might be a bit higher in other countries that may not have the proper equipment or knowledge necessary to treat the infection. But the exact number of cases worldwide is unknown. There's about 7 other Clostridium species that are capable of causing gas gangrene, but the one we're focusing now, Clostridium perfringens, is the most prevalent and accounts for 80 to 90% of the cases. If treated properly, the infection has a mortality rate of about 20 to 30%. But don't be fooled, because if not treated at all, there is a 100% chance of death. The bacteria is also considered to be ubiquitous, so it means that it's found everywhere, including our intestines and in animal intestines as well. The mode of transmission is either traumatic or surgical, but can also arise spontaneously, which is the scary part. What I mean by this is that 70% of the time, the bacteria arises from some form of trauma or puncture to the skin, or it could also occur on any surgical site. So when there's a loss of skin integrity, proper wound care is necessary, not just to prevent gas gangrene, but any other form of infection as well. During surgery, if dirty equipment is used on a new patient in the OR, then they're likely to develop the infection as well. Something important to note is that people most at risk for developing this are immunocompromised, diabetic, cardio patients, and patients with a low white blood cell count. Immunocompromised patients, they're at greater risk simply because they don't have the adequate immune response necessary to fight off the invading pathogen. Same goes with patients with a low white blood cell count, and cardio patients are at risk because some of them may suffer from poor vascularization that leads to tissue hypoxia. All right, so once the patient is infected and the infection is in the tissues, the bacteria releases these seriously harmful toxins. Some of them, specifically the beta and iota toxins, are responsible for cell death. This means that their release leads to tissue necrosis. The alpha toxin also works in necrosing the tissue, but is also considered to be hemolytic. And what this means is that it destroys blood vessels, releasing hemoglobin and further compromising blood flow to the tissues, which in turn causes tissue hypoxia, cell death, and necrosis. The kappa toxin, called collagenase, is an enzyme that works in breaking peptide bonds in collagen. The breakdown of this really important connective tissue allows for the rapid spread of the bacteria into the muscles. And lastly, we have the epsilon toxin, which is responsible for increasing the permeability of the cell membrane, which causes the tissues to swell. There are many other toxins, but I chose to focus on the most detrimental to humans and to our tissues. Now, these toxins are primarily the reason of most of the clinical manifestations that are seen and talked about next. But here on the right, we have a picture of the alpha toxin. So, the signs and symptoms include the usual symptoms of infection that are the fever, chills, pain at the site of infection. As you can see from the picture here on the left, there's also massive edema and inflammation at the limb. And in the late stages of the infection, you can see a black, almost gray or dusky looking appearance on the skin. Sometimes there might be discharge that smells musty, and some people say it looks like dirty dishwater. So yeah, it's not fun. Looks very painful. Diagnosis involves obtaining a tissue sample from the patient so that a gram stain can be performed. This is the most definitive form of diagnosing, but results can take about 48 to 72 hours to allow for the media to grow. The doctor can also order imaging studies such as an ultrasound, a CT, or an X-ray, and this is primarily done to see the extent of the infection, but you can also tell if there's gas in the tissues, which is the hallmark of gas gangrene. On the right here, you can see images of a patient with gas. Some of them are circled in red on the bottom. They kind of just look like bubbles floating around. And a blood test can also be ordered to see the white blood cell counts, but to also look at the arterial blood gases, lactic acid, and precalcitonin levels. And this is done to check if the infection has led to sepsis, which could be a possible complication of the infection and can also lead to death within itself. Prevention is the best way to avoid this. However, if a person does become infected and they develop gas gangrene, a possible outcome can be amputation if the infection is way out of control or it's found out too late. But before that, broad spectrum antibiotics are started immediately, even before diagnosis, because as we said earlier, the gram stain takes about 48 to 72 hours. And even a 24-hour delay can be deadly for some patients. The most commonly used antibiotics include penicillin and clindamycin. Some strains of Clostridium can be resistant to clindamycin but receptive to penicillin, which is why they're both started at the same time. But clindamycin is strongly recommended in this type of situation and is even considered the superior antibiotic of choice because it inhibits the production of toxins that were discussed earlier. Another form of treatment is immediate debridement, and that's done to remove the necrotic tissue. It's done by making multiple incisions on the affected tissue, thus lessening the bacterial load. The technique can stop the infection from progressing further onto neighboring tissue and can eliminate the need for complete amputation to conserve the limb for that patient. Another form of treatment is hyperbaric oxygen therapy, and it's used to suppress the growth of anaerobic bacteria, such as the one that we're discussing here. This therapy limits necrosis by relieving the oxygen poor environment in the neighboring tissue. Other less common forms of treatment can include Chinese herbal remedies that can be used alongside medical treatment. Some of these include oxygen peroxide as an antiseptic solution. Ozone is thought to inactivate the bacteria, and antitoxins can be used to alleviate symptoms caused by the toxins produced. So here on the right, the top right, we can see the wound being debrided, and that's usually done in the OR. The bottom picture is that hyperbaric oxygen therapy, and yeah. So, in conclusion, it's important to recognize a necrotizing infection as soon as possible and to start the broad spectrum antibiotics before diagnosis can be made, because this can potentially decrease the chances of amputation and death. Wound care is the best preventative care possible. Any patient coming home from the hospital with a wound should be taught how to properly clean and dress it. And I think it's important even for the public to know that if a wound looks infected, it is so important to have a healthcare professional look at it. And yeah, thank you guys for listening. These are the sources that I used. I hope you enjoyed my presentation. Thank you.